good, but looking good.
Mm.
So I am going to turn it over to Dr. Mann to introduce herself, and then we're going to get right into it. Welcome.
Hi, thank you so much. I'm so happy to be here and thank you for the invitation. So I am Dr. Theresa Mahon. I'm a board certified OBGYN and in practice for 24 years, just about in a couple of months. And I am so delighted to be here to talk about postpartum recovery.
Yay, we are so glad to have you because I know the initial one didn't work out, but we made it work. Thank you so much for coming back with us.
My pleasure.
Yay. So, okay, so we're going to start with, because I think when we were talking in the background, we were talking about postpartum recovery. So, from your perspective, after a woman has a baby, can you kind of walk us from your point of view, what that whole process entails?
Oh, sure, gladly. And it's something that I have come to learn a lot of moms feel like they are not prepared for. They do a lot of prep for the birth, but then the postpartum period sort of gets lost. And so postpartum, as you know, is from the time you have your baby. Some consider it to be 6 or 8 weeks after birth, because that's when all the changes your body made being pregnant kind of goes back to its pre-pregnant body. But the truth is, the American College of OBGYN actually considers postpartum up to 12 weeks post birth. So, what changes happen after you give birth? Well, you would know because you've had children, right? But any mom to be who's not had a baby may be surprised that after birth, you are kind of beaten up down there in your vaginal area. You may have a lot of swelling. Sometimes during birth, you can have tears or cuts that happen that can be very uncomfortable after you've delivered. There's bleeding that goes on that can last for weeks up to a month. Some moms have breast engorgement as their milk starts to come in. And I'm saying these things not to frighten anybody, but to be prepared. I've gotten on social media recently, and because I actually invented something for mothers postpartum, but the reason I am talking about this is because I was so shocked to read that really mothers felt they were not well prepared for postpartum. And so it's really, really important because pregnancy and childbirth, there was a study out of Duke a couple of years ago that said that experience, the energy expenditure of that experience is like elite athletes running a race from California to Washington, D.C. over weeks and weeks and weeks. That's how much energy a mother expends. So this is really, really important. So again, not to frighten anybody, especially anyone who hasn't had a baby yet, but so you're prepared. And there are things we can do to help you with that.
Absolutely. So I know part of the topic that we were going to focus on was vaginal pain. So, one of the things I was curious about is, how often does that happen? But I feel like it would be obvious that, most people or most women that have a baby that comes through there, that there would be some discomfort. But so I guess from your perspective, how severe, can it be? And, what are the challenges that you as the, gynecologist, OB-GYN, helping mothers, what are you seeing and what are you helping your mom patients with?
Okay. So, with a vaginal delivery post-birth, many women, I would say, I don't want to say it's universal, but it's almost everybody can have swelling, a lot of swelling. I've had mothers say to me, I don't even recognize myself down there after my baby came because they're very swollen. That's probably the biggest thing, but there is definitely discomfort after birth. It's very normal to have cuts in the vagina or at the base of the vagina, between the vagina and the rectum after you give birth, and those get sewn or sutured. And just like any cut that has to be sewn closed, it's uncomfortable. So this is pretty typical, probably more so with women having their first baby. So for years, I would go see my mothers after they gave birth, and we didn't have a lot to offer. We would give mothers a diaper with ice in the folds or ice in a glove and a washcloth to put between their legs to sort of help, because cooling treatment actually helps with swelling and the initial discomfort from these kind of tears and cuts that happen. So, and I would be out of my mind saying that, why do we have to give this woman a diaper after what she just went through? This is so terrible. And so that's kind of what led me to develop a postpartum panty with a pouch in the crotch that holds an ice pack for mother to wear so she can have nice, dignified cooling relief and be up out of bed. But that's typically what I would see postpartum for my moms.
That's awesome. So the other one I always ask about is, because I want our listeners to, like, if there's anybody going through this or they've just had a baby, they have actionable tips and steps to take to help towards the topic we're talking about. So for us with vaginal pain after delivery, what actionable tips would you give anybody listening that has just had a baby to minimize pain in that area?
Okay. So first of all, if you have no allergies to medications, believe it or not, Tylenol and Motrin are really great to take. They help a lot with that pain. Cooling packs are really great to use. Hospitals now have these chemical packs that you crack, and it's almost like in a pad, like a sanitary pad. They stay cold for about 10 minutes. And then it kind of dissipates. So it's not a lot of help. But in the beginning, nice cooling packs can help. Sitz baths, that was a thing when I did my training years ago. We were talking about sitz baths with mothers. That really helps too. It's a nice round pan. Most places do carry them. You can buy them in pharmacies or Walgreens or CVS or whatever your local store is that has those kind of items. It's just a round pan that looks like you could do dishes in it, actually. You fill it up with some nice warm water and put it on lift up your toilet seat, put it there, put the seat down. You can sit on that and soak in a nice warm bath, just plain warm water. It can also be very healing. So both cooling and nice warm water can also help with healing after birth.
Absolutely. Thank you for those tips. And then you mentioned that you had something that you invented, underwear that has a pouch. How can people get that?
Yes. Okay. So that's the panty I created, PIPs Panty, P like postpartum, PIPs Panty. And it is a boy short underwear that has a pouch in the crotch that holds a sanitary napkin and an ice bag, literally, that you just fill up with plain ice, because most birthing suites, birth centers, hospitals don't have refrigeration or freezer capability to freeze an ice pack, but they do have ice.
Right.
Because women take ice during pregnancy, during labor, pardon me, they're, drinking water and having ice chips. So there's plenty of ice to be had. The bag just holds regular ice cubes, ice chips, whatever you have. You slip it in the pouch with the sanitary napkin. It has a hole in the center of the pouch, so any bleeding goes right through to the sanitary napkin, but the nice cool pack stays against mama's bottom, which gives a lot of relief. And so that's my panty that I finally said somebody has to do something, and thought, well, that should be me.
Absolutely. Wow,
So,
that's really cool. If you have the information on how to get that, we can always include that as well with the
oh,
PIPs.
sure. I have, I have a website, PIPs Comfort Care, and you can go right on there. There's a little video that shows how it works. It's very simple and very easy to use and very helpful.
That is awesome. Okay. So the other thing I usually do, I switch gears a little bit, and this is kind of more about you. So I always tend to ask, docs that come on, why do you do what you do? So I'll ask you the same question. Why do you do what you do, doc?
Oh, well, you know something? I actually did not come from a family of doctors. I kind of didn't know what I wanted to do after college and worked for many years. So I was not a traditional student when I finally decided to go to med school. And even though I liked so many rotations in medicine, when I did obstetrics, it was so joyful. Honestly, that's what grabbed me. It was so joyful. And you get to practice medicine, you get to do deliveries, you get to do some surgery. And I just absolutely fell in love taking care of women taking care of them during their deliveries. And it was so nice because you develop a relationship with people over months of pregnancy while you're taking care of them. And that just really grabbed my heart more than anything else.
That is amazing, and it takes a special person because that is definitely a very vulnerable time for women when they're
Oh,
at.
absolutely. Absolutely.
So we appreciate your work. The other question, and
Hmm.
this one is, a little bit different. So the way I ask it is, with all the experiences that you've had and all the life that you've lived so far, if you got an opportunity to talk to your 20-year-old self, what would you tell them
Oh.
and what would you advise them?
You know what I would tell my 20-year-old self?
Mhm.
Have confidence in yourself.
That's
Believe
good.
in yourself. Everybody is not perfect. And for me personally, I always looked at others. We judge people by their outsides. Everyone
Mhm.
seems so put together and
Know
has
what's on
all
the.
the yes, yes. And inside we don't know how they truly are. And so for myself, I would say have confidence in yourself, have confidence in your gut reactions to things, trust that inner voice inside. It's there for a reason. It protects you, it can help you. So that's what I would want to encourage my 20-year-old self.
That's awesome. That's beautiful. So, okay, so Dr. Mann, how can people get a hold of you, look you up, if they wanted to find out more, if they had questions for you?
Oh, okay. So I am on social media. You can direct message me. I'm on Instagram, Pips for Moms, and it's PIPS and the number 4, Pips for Moms. I'm there. You can direct message me. I'm also on Facebook at Pips Comfort Care. Shoot me a question if you want to talk. That's totally fine. Love to hear from you.
Thank you so much. This was so good. Thank you so much for giving us all that amazing information. So, guys, definitely check her out. And on the flip side, if you're looking for a quality primary care physician, we are accepting new patients at Apple Valley Family Medicine. Our website is www.applevalleyfamilymed.com. And you can also give us a call at 304-350-1087. So you guys have an amazing week. Dr. Mann, thank you so much.
Thank you so much. It was such a joy. Thank you.
Thank you.
Bye
Bye.
bye.